Hi, my name is Michaela. I will be demonstrating a piggyback method of IV infusion. So to begin, you would get your doctor's orders and you would compare it against your MAR. You would be looking at the dose, the route, the frequency, and the medication. You would clarify that your patient can receive those by comparing it against their labs, and their history of allergies. Today my patient is going to be receiving Flagyl. It is a bactericidal that stops bacterial DNA and protein synthesis. Some side effects are dizziness, headache, nausea, vomiting, and abdominal pain. An adverse effect you have to watch for is seizures. The recommended dose is 500 milligrams every 6 to 8 hours. You can't do that any longer than 4 days. Implications for this is before you start the first dose, you have to do a culture and sensitivity on the patient. You need to monitor the patient's neurologic status, as well as assess for a rash and Stevens-Johnson syndrome. My doctor has ordered 500 milligrams every 6 hours to be infused over 60 minutes in a 100 milliliter saline solution. The drug comes in 500 milligrams in 5 liters, or 100 milligrams in 1 milliliter. So to make the 500, we're going to be administering 5 milliliters. So I'm going to prepare my medication. I'm going to wash my hands and put on my gloves. I'm going to verify that my medication is not out of date, and it's not. I'm going to clean my medication. Get some
I will wash my hands using the aseptic technique. I will draw out 1 milliliter of vancomycin. We'll check the expiration date. Expiration date is good. And then I would clean the bottle.
I'm going to set that cap, and I'm going to get my 100 milliliter saline solution, and I verify that that's not expired, and I'm going to clean the hub of that, and I'm going to administer the Flagyl in the saline, being sure not to perforate the side of the bag.
I would inject my medication to my Piggyback.
All 5 milliliters. I would then throw this needle away in the sharps container and gently agitate my medicine. Then I would put a label